time spent in preparing the cingulum is worth it, because the whole life of the restoration depends on the cingulum preparation. So, can I get a little light now? Yes, it's a blind procedure. I have finished the cingulum preparation as much I could. Possibly see here, thoda vertebra. I will now use the American football diamond, which is here in my hand, and I will prepare the palatal fossa. I will sink this diamond into the fossa and then move it mesiodistally. Clearance is no issue here because this fellow is having a edge-to-edge bite, so I really don't have to bother much about clearance, but I have to see that I remove 1.5 of the enamel, so that when he gets his crown back, the crown has the same contour as his original teeth. So there we go, and we make the incisal bevel. The $1 million bevel, absolutely, because this is the resistance form of the preparation. These are some lost parts of the dental profession, I call them. A incisal bevel. Most dentists don't bother about it. We leave the preparation as it is and it is over. For a PFM restoration, please give a bevel of an angle of 45 degree, close up front, close up, close up, close up. 45 degree angle like this, and for an all ceramic restoration give a shallower bevel of 30 degrees. I will have to show, this camera needs to show it, I think. So there we go, and we give a small bevel for an angle of 45 degree to the tooth. Again a technique which could be used when it is light or when it is dark. So you round off the corners if you wish. You start the aerotor, you stop the aerotor, you start the aerotor, you stop the aerotor, and you finish the restoration. If you want, of course, you could use the red line diamond points, you could use the yellow line diamond points, you could use carbides, whatever you wish to finish the restoration. Once this is done, the preparation is complete, we close the patient, ask the patient to close, we check his clearance, a beautiful 2 mm clearance is there everywhere. We have fabricated for the patient, aakar zara. We put the silicone key into the patient's mouth and we check the silicone key if the fitting is proper. In this tooth I have to inject the material, so I have marked here. I will take Johnson's KY jelly. Johnson's KY jelly, another beautiful material. It can be used in the bedroom also, as well as can be used in the dental clinic also. The normal setting time for cool temp is around 50 seconds. So please keep checking if the material is set. If it is set, retrieve it immediately and you have a beautiful temporary ready here. I hope you appreciate this temporary. Can you show this temporary to everybody? At close up, thoda pude vaktos, and show this temporary. Absolutely perfect, and it would be there in his mouth exactly like the wax pattern what we made. So if your dental technician or the person who did the wax pattern is a good guy at work and he can make very good wax patterns. Royco stay put cord, which is a copper wire cord with a copper wire inside. We have the Royco gingiva liquid, which is an astringent solution, and we have the Royco cord packing instrument. So these three things what we will need for packing our cord. We will use little Lignox spray for him, one, that's it, and we will wait till the temporary becomes hard and we will use this temporary to pack the cord. I've already taken out the gingiva liquid into the Dappen dish here, and I've put cords inside of the length because I had a study model, so I knew which cord to take out. Everything is ready here. I will take the cord in my hand. I will take a small I will take a small tissue paper. I will dab it over the. This made me think for a new procedure, and it worked very well for me in my brains. And what I started doing is I started making a temporary for the patient before we did the cord packing. So this is the temporary. With the help of this temporary now, I will show cord packing to you, and you will enjoy this procedure. I don't know like what. So take the Royco cord. I hold this Royco cord on one of the distal aspects of the tooth. I will pack this cord here into the proximal. The cord has already gone in, and rather than starting to pack the cord now, I will take my temporary and I will push my temporary in position, and with the help of this temporary now I will pack the cord. This cord, suck please. This cord has a copper wire. Because of the copper wire, you can shape this cord beautifully the way you want, following the contour of the gingiva. So there we go, I will not trouble this patient anymore. The cord will be inside his mouth for 10 minutes, maximum 30 minutes. So there we go, we remove the cord beautifully and there is no bleeding. One reason because scaling was done before, and the second reason we never packed the cord, we tucked the cord. Once this is done, we take a tissue paper and we wrap it on his tooth. So there I go, I support the spiral tip and I start injecting the material this way. Keep the tip submerged into the material. This is a silver light body which I have been using. Once this is done, Rahul will remove 2/3, 1/3. I will take the impression tray in my hand and I will inject the material.
You need a lot of force, okay, when you do this?
Yes, not lot of force.
For
and
me it's
looking
lots.
at my wife and her fragility, of course we need lot of force. You ask me to do it and the whole cartilage can get over in no time. So there we go and we support the tray. Oh, you don't have to push the tray now like this. Reason, the beauty of this impression procedure. Keep it wet as it is. I will take my crown in my hand and I will take Temposil and I will load the crown right from the bottom here and I will keep, this is Temposil 2. This is a unique product on the market, one and only one. Now frankly speaking, it is not a zinc oxide eugenol cement. This cement is a cement which is a silicone. It is actually the same material which is called as a foam cord material for gingival retraction. Dinesh should not get up from my chair without a temporary. So I have fulfilled his birthright undoubtedly. He will go home happily today. I am sure his girlfriend will not come to know also what I have done for his front tooth, except for the class 4 bit fracture which I have completely blocked today.